Good evening, everyone, and warm greetings to you. Thank you for taking time and joining us for what is our seventh MCC webinar, a look behind the scenes at MCC's work. We have people joining us on Zoom and via Facebook from multiple countries. So warm greetings to all of you. We really are glad you've chosen to be with us. And thank you for your ongoing support for MCC, for your interest in our work. We're thrilled that you're part of the MCC story and thrilled that we can offer you this quite unique view of the way we serve in the world in the name of Christ. We're also aware that this continues to be a challenging time for some of you more than others, but many of you who are joining us tonight are dealing with new waves of COVID-19 and the way that's impacting your lives. Be assured of our prayers. My name is Rick Kober-Bauman, and I serve as MCC Canada's Executive Director. And tonight I'm coming to you from my home. I'll be hosting you, and I'm in the little hamlet of Shakespeare, Ontario. So let me say a little bit about the logistics. Many of you are familiar with how to be on a Zoom webinar. As a participant, you'll be kept muted throughout the whole webinar. But if you'd like to raise a question, if you're on Zoom, please go to the Q&A function, and you can find it in that bar, that black bar at the bottom of your screen, which will show up when you move your mouse. And if you've come on via Facebook, welcome to you, and you too can submit questions. You'll need to use the Facebook comments section. And one of my colleagues will be monitoring these throughout the hour, and we'll try to answer as many of your questions as we can. We are recording, and so the recording of the webinar will be made public following our live presentation. And what is it that we're going to talk about tonight? Let me introduce you. Our topic tonight, women and girls and COVID-19. Global crises like pandemics often hit women and girls the hardest. So this evening, we're going to take a look at our work through a gender lens. Lisette and Annie, our guests, will share stories of hope and resilience, and they'll explain how your support has helped women throughout the pandemic. Each of them will present for about 10 minutes, and then we'll have the remainder of the hour, about half an hour, we hope, for questions and feedback and conversation. So we look forward to hearing from you. Please do listen attentively and post your questions to enrich our conversation later on. And now to introduce our guests, Annie Lowen. First, Annie provides resourcing and support to MCC International Program staff and our partners who are working to provide food assistance and shelter reconstruction and other kinds of emergency assistance programming around the world. Annie lives in Winnipeg with her husband and 2 daughters. Our other guest tonight is Lisette Miranda. Together with her husband, Cesar Flores, she is MCC Area Director for Central America and Haiti, providing support and leadership to MCC program in the region. She's based in San Pedro Sula, Honduras. Her 2 children are currently living and studying in Winnipeg. So with that as our introduction, I thank you again and welcome you to the evening and invite my colleague Annie to begin her presentation. Welcome, Annie.
Thanks, Rick. I'm really glad to be with you all here today. This is my first time doing one of these, so I apologize if I have any screen hiccups here, but hopefully you can all see my screen now. But yeah, thanks for the introduction, Rick. I am very privileged to be able to work with MCC partners around the world, and I, prior to COVID, was very lucky in being able to actually meet with some of our beneficiaries and see the work that MCC and our partners are doing in their lives. So one of my areas of interest and focus with my work is looking specifically at how disaster impacts women. And often when we think about disasters, we assume that the impact is felt equally by both men and women, and we assume that the risks that men and women face are the same. But what's often surprising is that that's not necessarily the truth of the situation. So the reality is that men and women do not always experience crisis or disaster in the same way. The risks that they face are often unequal and they're often quite different. So many of us have heard from different news outlets or other conversations about how COVID-19 is disproportionately impacting women. And we can see this throughout the entire world. It's not just, women in sub-Saharan Africa. It's also women in Canada, women in the US who are feeling the impacts of COVID-19 differently than men. And the other day I heard it referred to as a she session instead of a recession. So the focus being that it is disproportionately impacting women. So start my slide here. So some of the ways, obviously, there are health impacts of COVID-19, and the International Labor Organization estimates that most countries, their first responder caregivers are at least 70% to 90% women. So these are frontline workers like nurses and personal care workers, healthcare attendants, and these workers are experiencing higher rates of infection because they are taking care of sick people. So we see that women are often the caregivers when someone does fall sick to COVID-19, and that is a risk that women take on in that role. Women are also more likely to have become unemployed because of COVID-19, and this is particularly true amongst women of color. This is a trend that we have seen across the globe in nearly every country among women of all social and economic classes. The actual numbers change for each country. I've used 19%, which is about an average, but you'll see that largely, even during the pandemic now, when men have begun to return to the workforce, women are continuing to leave. There are many reasons for this, but we can point to women being more likely to be employed in jobs like retail or hospitality, selling in local markets, or working in a textile factory where that work cannot be done remotely. And often those types of industries are more informal. It may be a woman who is cleaning someone's house, and because of restrictions, she's not able to go to her job anymore. So this type of work is likely to be very interrupted by those restrictions and closing of hotels and restaurants. And particularly when we look at smallholder farmers around the world, women account for about 60% of those smallholder farmers. So when local markets are closed, when the borders are closed, accessing seeds, accessing areas to sell your produce have been interrupted. So this has had a pretty significant impact. And in the photo, you can see a photo of a project in Jordan where we're working with women through a local partner to teach them sewing skills and cooking skills to try to help them locate another livelihood opportunity for themselves. Other impacts are the more social impacts of COVID-19, and women and unpaid work has increased significantly with COVID-19. Women are feeling a lot of demands on caregiving, both when someone falls ill and also, when children are unable to go to school, and those caregiving tasks are likely going to fall to women in the family. Before the pandemic, it was estimated that for every 1 hour of unpaid domestic work provided by men in the household, women would provide at least 3 hours of work. With the pandemic, we've seen that those numbers are sometimes doubling from what they previously were. And women are facing a lot of pressure to leave their jobs simply because they don't have the time anymore to be able to be employed and then also do all of the work that they have at home. A significant impact has been the increase in gender-based violence that we've seen. And this again is across the globe. It's not just in other areas, but here in Canada, in the US as well. Statistically, here in Canada, domestic violence crisis lines have been reporting increases of up to 25 to 50% in their called volumes compared to the pre-pandemic. A recent study from Africa showed that women were reporting there that they were much more worried about domestic violence. Up to 73% of women felt that there had been an increase in their lives. And the increases in violence are driven by that household stress from lockdowns and from loss of income, from increased levels of security personnel, which pose dangers to women who are leaving their homes. An increased need for water, for hygiene practices, means that women are collecting more, doing more water trips. So we see that when women leave the household and are walking to collect water, a third of women and girls say that they have experienced harassment while they're collecting water. So the physical and the emotional impacts of gender-based violence, combined with the social stigma that women face with being a survivor of gender-based violence, those have significant and irreversible lifelong impacts. So what is MCC doing? The woman that you see on the screen there, her name is Sangani, and she is a participant from MCC's local partner Oasis in the town of Baraka in eastern Congo. Sangani was displaced by conflict in her home community, and she was forced to move with her 9 children to a new town with no support. She had created a small business of selling rice in the local market, and she was selling enough to be able to provide 1 meal for herself and her children every day. But when COVID-19 came, the market shut down and she was left without any source of income. That's when staff from our local partner Oasis came and they discussed her situation and invited her to join MCC's project. When she joined the project, she received a food basket with flour and beans and oil, and along with that, also receiving some livelihood support through the provision of seeds and tools, access to a rented plot of land, and some agricultural training. She's now able to provide food for her family again, and she received education about COVID-19, learning how to wear a mask, washing hands regularly, and social distancing to provide protection for her and her children against this disease. In Lebanon, we often see with COVID-19 that it is not working alone. There are also other factors in people's lives. So in Lebanon, following the Beirut explosion last fall, one of the families commented that they were no longer able to go out to work in the same way because one of them was injured in the explosion. And then on top of that, COVID restrictions meant that the male member of the family could no longer go and make deliveries using his truck in the same way. That's when our partner, PARD, located in Beirut, came to the aid of this family and provided them with a monthly food voucher where the family was able to then access food that they were economically not able to access before. And the respondents in the family told us that being able to receive that voucher had a significant impact in the mental health of the main caregivers who were women in the family. Obviously, not being able to provide for your children is a very stressful thing. And so being able to have that grocery card meant a lot to this family, being able to relieve some of the stress and allow a bit of release of tension for the whole family. But those are just a few of the stories. I think there's a lot to say on this, and I'm looking forward to your questions, but I'll pass it on to Rick again, and we'll look forward to hearing from Lisette as well.
Thank you, Annie. Of course, throughout these last months, I think many of us have seen statistics, and we've read various accounts of how there is a gendered impact from COVID. So it's really helpful to have you walk through some practical, personal story accounts of how MCC is seeing this at work. Annie, if you don't mind turning your camera back on for just a moment, I'm going to invite Lisette in just a second here. But yeah, so thank you for kind of personalizing and bringing this home. This is kind of a personal question for you, I suppose, but what makes you so interested in going deeper in the gendered impact of our work generally, and now very specifically in COVID? You've obviously taken a pretty deep dive here, and what drives that for you?
Yeah, I mean, in my experience, maybe one of the stories I could tell is, talking with women in different MCC locations about, 10 years ago now, which seems like a long time, but I was in Rwanda, and there was actually women displaced or families displaced from the Democratic Republic of Congo. And I was privileged enough to visit with a partner, a group of displaced people. And in conversation with some of the women in the group, realized how little their voices are heard in those situations. Often, the group is dominated by men. It's men who are the pastors, who are the heads of the household, who are the community leaders. And so they were able to have their voices heard, but this group of women was kind of sitting more to the side, just quietly in the back of the room. And when I approached them at the end, they were so thankful for the listening, the opportunity to talk to me about what was happening in their lives. And I think the more that I work with disaster, and the more stories I hear, the more statistics you see that it's not, we often assume that there's one perspective on a crisis, that everybody is impacted the same way. But the closer we look at that, we see that, if women are caregiving, they're taking care of children, that's a different kind of work burden than a lot of men feel. And similarly to that, like even elderly people, I've been in situations where, we didn't consider that people aren't able to chew food after, you've lost teeth. So these are important factors if you're impacted by violence, by conflict, to be able to provide people with the best response possible. And that might mean it's a bit more individualized. It's not all, everybody needs the same thing. Everybody has different needs at different times.
I mean, that sheds a lot of light on, I think, some of the values that are core for MCC in terms of how we do humanitarian work. But this is not a blanket or one-size-fits-all approach. Gender is certainly one of the very important lenses, and that's where we're focusing tonight. Thank you for that.
Thanks.
Now we do want to hear from Lisette as well. And Lisette, you can imagine I might have some personal questions for you, or others might as well. And by the way, as we're switching over in presenters, I remind you all, whether on Facebook to go to your comments, or if you're on Zoom to go to the Q&A. We're happy to have you start logging those questions. I probably won't interrupt Lisette to ask those, but certainly when she's finished, we'll have a chance to hear more from her and from Annie. So Lisette, please, we're looking forward to your presentation. Welcome.
Thank you, Rick. It is a pleasure and also an honor to be here sharing about the work that MCC does and how that is impacting and changing the life of the people that we work with. And today I'm bringing two stories that are really just a sample of how people in Central America have faced the COVID situation, both how they have been affected, but how they have been able to respond. The first story is from women in Guatemala City, in Guatemala, where
I don't want to be a further technical problem here. I'll just say that it looks like we're not
yes,
getting our program moving.
yes, it is now moving. But anyway, I want to tell you a little bit about Guatemala. Guatemala is it's a country where have 45% of indigenous people, and can you, as you can imagine, the situation for indigenous women, it's very complex, because if you are in indigenous and live in the rural areas, you then have to face not only being an indigenous, but also facing situations where there is your voice is not heard, then you have little impact with the decisions made within your household, but also within the in the community. So MCC has been partnered with Anadesa, which is located in Atitlan Lake, which it's called the New Dawn Association for Santiago Atitlan. And we work there with a group of women that they call themselves proactive women. And they get together to do some jewelry that will mean income generation for their houses. They also have a small business. They also imply for a little income for their families. This community have funding, get most of their funding through the tourists that comes to their communities. They shop what they have. And also the organizations provide trainings for the women to know more about their own right. They also get to learn about how some health practice, and provide spaces to bond and accompany each other. As you can imagine, through the lockdown, Guatemala, Honduras, and many of the countries in Central America decide to have a complete lockdown, like from a Sunday to a Monday. Many of those women just were locked at their house and communities, and they were not able to sell their products. Their husband, some of their husband were working somewhere else, so they were by themselves in their houses. So through the program and with some of the MCC funding and some of the saving that the women have, they decide to purchase some food and for the participant in the project. And one of the neat things with that was the women could come and shop, but without money. So they will come, they put all the grocery that they have bought, and women will come and pick up what they needed. And with that, they found themselves that they were able to share, and they invite other women in the community that were needing food to be able to face the many months of lockdown and no income within their communities. I think this is a way when you have little, you share, you open your house, you open your tables, and you bring together whatever you have with in the community. Another story that I want to share with you today, it is in Honduras, and this is especially about one woman. Her name is Ela Castro. She is a medical doctor, and she was serving in one of the MCC program in Guatemala, that it's the migrant house. And she felt the call to take a year to serve other people. And the people at the migrant house is people who is in the way to the north, looking for different opportunities to make a living. So they stop at the migrant house sometimes after a week, 2 weeks of being in their journey. And one of the services that the migrant house provide is medical attention. So Ela has the opportunity to serve the people that was in the way. And one of the things that she told us, it's like many of the people that came through the migrant house was people from Honduras, her country of origin. When the lockdown came, Ela remained in her country of assignment, that was Guatemala. But after 3 months of being housebound, she decided like her skills were needed in Honduras, and as a medical doctor, she was able to travel, and she has to walk some kilometers and finding rice and being able to get home. And she became a migrant herself in that time after being 3 months in lockdown. She returned in June to Honduras, and this is her family. They're a very close-knit family, and her dad and her mom has been pastors in a number of Mennonite churches in Honduras, and they have a call to serve others. And through the pandemic, her dad continued to serve the people in the church and in the communities. And that was very important for him to be a present only to be affected later on and getting sick from COVID. And this pastor passed away in July. And when Ela heard that her dad was very sick, she came and take care of her dad. And what happened is like the medical and health system in Honduras was very and is still struggling to have doctors attending, nurses, and have people who can provide care for the people who get COVID. So Ela decided to volunteer at the hospital where her dad was very sick. Unfortunately, her dad passed away, and then she contracted COVID. She, her mom, and another sister were very, very sick. Something that Ela shared with me, it was like after her dad passed, she was not only fighting COVID, but also she has a very deep grieving process. She was very close to her dad, and also she was feeling that it was missing him a lot. In November, Honduras was hit by ETA and IOTA, and that came in top of COVID, that came even to impact to more people within in Honduras, Guatemala, and Nicaragua. They say that around 9 million people were affected by those two hurricanes. And Honduras was one of the countries that was hit the hardest. This is close to one of the Mennonite church in Honduras, in San Pedro Sula, the city where I live. And Ela was debating, how should I do? What should I do? She had no going back to practice the medicine. And as she struggled with that, she decided one more time that a better way to deal with the grief and the pain of that she was dealing with after losing her father, it was a way also to honor his memory. So our church opened a shelter at our church for people who was affected by the storm. And then Ela came in and she started attending to the people who have been in the shelter for a couple of days. And she just rushed in and started working there. And that was after the waters went down, she went to the communities where has been hit by the hurricanes, because she knew that people need help. So we have here Ela in the back of a pickup giving medical attention to the people in the communities. Once again, we see somebody who has a heart to serve. It was ready to serve. And here is Ela now back in January, and she was ready to continue service. And something that she keep saying, COVID had hit us hard, have taken many people that we dearly love, but as a way to honor those people, we need to continue serving and giving. And even when you struggle and you have little, you can still make a difference by sharing what you have, sharing your skills, and sharing your knowledge with the people that you are, that you can be and make a difference. And I think those two examples from the women in Guatemala and also Ela example give us the opportunity to recognize that COVID, it is affecting communities, country, and sometimes can become very personal. It is more than something that is happening outside your communities or the cities where you live. It is affecting people with names and people that you love and also you serve. So I think this is very important to remind that we all have a choice how we want to see the pandemic as something that is out there, is bigger than us, or how we want to make a difference in people's life. Thank you.
Wow. Thank you. Thank you, Lisette. I was particularly taken by the story of your doctor friend, Ela Castro. And there's so many layers. I mean, there's the emotional part of her connection to her own family, her father, a pastor, but then also, and I was thinking of this in Annie's presentation too, that COVID didn't just happen as kind of the only thing that was going on in 2020. You talked about the two hurricanes, and the fact that there's all of these issues for asylum seekers and people on the move in Latin America that then intersects with the impacts of COVID. So there's rich places to ask you some more questions there about some of those people and some of those stories. I told you I might ask you a personal question though too. So before we get into more of those kind of content about the people you spoke about. Let's just ask a little more about Lisette. You know, you're a mother. We have two women tonight presenting about COVID and the impacts on women. Both of you are mothers. You're both professional people who bring your skills into the workplace. So let me ask you, you know, what are some of the places that this has touched you personally as you've watched this year of COVID unfold? What are some Lisette impressions?
Well, we as a family lost my brother-in-law just in March 25th. And
Sure.
and that's, it was like, again, like when you feel like COVID get personal, that was something very hard. And then being in lockdown months after months, only going, being able to go out of our house every 10 days, depending on your the last digit in your ID. So being confined and within that, I think something that really I also missing my children. So I haven't seen them for now since last year, since December 19, I haven't seen them. That's in the personal level. But I think I also feel privileged to have been able to accompany the programs, the MCC programs that has been responding in the middle of all this. We have partners and service workers and MCC workers in the ground being able to respond and to accompany people. I think that has sustained me a lot during times when you ask yourself, like, how can we continue providing support when I see people here in the ground serving. And as you saw the picture of Pastor Ela Castro, he was there serving his people, and he didn't stop until he got really, really sick.
So I'm struck by how much, when you tell tragic stories, they're also hopeful stories. Like, you know, there's a certain hope that I hear you drawing from the way Lino continued to serve, the way many other women have, like the doctor, have stayed engaged and not pulled away. And I would say, even from the distance that I'm at here in Ontario, Canada, that's often a source of hope for me, and why working with MCC in this past year especially has been itself a source of hope. I'm struck by that, and I'm not nearly as close to people like Ela Castro as you are. I'm starting to get some more questions here. Before I take those, I'm struck too by some things you talked about, Annie. I know a little bit about the partner in Lebanon, PARD, and often when we hear the word Lebanon in the last 6 months, we think explosion. And so again, something very destructive that was layered over what people were already dealing with in Lebanon. Can you say a little bit more about how women and girls are affected and are more deeply impacted, not only by COVID, but in the other areas of MCC work, and especially when we get these things layered on top of each other, you know, hurricanes on top of COVID, or COVID on top of explosions. Annie, can you say a bit more about that?
Yeah, absolutely. Yeah, I mean, you're exactly right. It's layer upon layer, right? So the work that PARD does in in Lebanon is specifically working with people who have been displaced. So many of those people are from Syria, some are from Palestine. So that in itself is a significant change. If you can imagine taking your family and having to go thousands of miles away into a new country where you don't have, the same legal status that you had in your previous country. Your kids might not have access to the same kind of schools, the same language of school even. So those are significant changes that happen. And, I imagine my life as a mother, I have, you have your routine, you have the things that you do, the places that you go to get your groceries and, do your laundry, all of these things. And to suddenly have all of that uprooted, you don't know where you're going to be grocery shopping. You don't have the family and friends to rely on to watch your kids. Everything is so different, and suddenly, what is the role that women have? And a lot of times it's significantly different. Suddenly you're caring for your children, 24 hours a day, whereas they used to maybe go to school, or perhaps someone was injured in your family and you're having to take care of them. It's a significant burden. It's taking care of not only your family's physical needs and your own physical needs, but the emotional needs of having been displaced, having children who are asking questions about, why can't I go play with my toys in the yard that we used to have? And our partner PARD does such an amazing job. I've been very privileged to be able to observe some of the amazing trauma healing work that they do with women and children. And it's really, I'm kind of tearing up just thinking about it, but to be able to see how our partners, Lisette, the story of Ela, our partner staff and the volunteers that they work with are just incredible. And, even though they have all of these other things happening in their own lives, they're dedicating their time and their effort to working with other people who are even more vulnerable than themselves. So yeah, coming back to your question, Rick, I've kind of gone off topic there, but
Okay.
yeah, COVID is kind of layering upon all of these other things that are happening in women's lives, the responsibilities that they have of taking care of the physical and emotional needs of people. And so, having even more restrictions on top of that is just, it's hard, but, life still happens. People still get married, people still pass away, but you have to keep moving your family forward. So yeah, it's challenging.
Yeah. One of the questions that's coming in here is asking about whether COVID introduced new vulnerabilities or if it just exacerbated the things that were already there. I'll put that to either of you. How
Yeah,
would you
maybe
answer that?
I would say that that's exactly it, is that these things existed previously. There was gender-based violence, there was inequality, but COVID has really shone a spotlight on these things, and it has made it really apparent the inequalities that exist between men and women, the way that women are disproportionately affected. Women's jobs are often more insecure. They don't have the same kind of benefits, the same, prioritization. I know even for some of my friends here in Canada, when your children are having to stay home from school, when you decide who's going to be able to go to work, is it your husband or is it you? It's oftentimes going to be the mother. So that kind of decision making that happens, the cultural norms and the roles, those have all been there, but the COVID has really, shone a light on those things. Yeah, Lisette, I don't know if you have anything to add to that.
And exactly what you're saying, that's very true. And the fact that even if that was little network of support for the women's, now with COVID and being in lockdown, like just imagine like somebody only going to be able to go out every 10 days. You are in your house for 10 days without like a lot of opportunities to relax, to just be. So immediately everything is just out of reach for you. And that is the reality for many of the women. Like even the little networks that they used to have, sometime at church, sometimes within the family, with the lockdown, everything was taken away. And like I say, it was taken away, like here in Honduras, government decide to shut down the country on Sunday. Like by Monday, everything was shut down. Like you didn't have a choice, just to stay wherever you were. And we were in lockdown for 7 months almost.
You know, I should tell both of you, Lisette and Annie, that some thank yous are starting to come in on the Q&A for both of you. So I'll start to pass those on to you now. Another question, just as I think asking us to broaden out, what are some of the other ways that we are attentive to gender in our work? I mean, we've been talking very specifically about COVID tonight, then we talked about, you know, other disasters layered over that. Would either of you want to comment on other ways in which having a gender lens shapes and impacts the way MCC does its work? Lisette, would you want to comment?
I think one way is like, for example, where we doing response, who are we asking for? How the response is gonna be done, and what they need. That is something very important. And for example, in my pictures, I don't know if you, but I still have with the women's in the Atitlan Lake. It was very interesting that they decide to get sugar, some cookies, you know, little details that was very important for them to have it. So instead of just only taking like the list of what we think, but hearing from the participants what they need, it's very important for in the way that we do response. In hearing, not always having like one size applied for every context. And in some places, it might be different. And as we talk with Annie, because we do a lot of talking within the responses, it's like always she's asking, okay, like everybody in the community has been consulted from what they need in the way that we respond. Because if not, that won't honor what some of our core values about that we want to hear from the people that we are serving.
Wow, it sounds like Annie's a pretty core resource for you there in San Pedro Sula. And I appreciate again, I mean, both of you talked earlier in your stories how we are always trying to listen to partners, respond to fairly specific expectations or requests. And yeah, I think that's a long held, deeply held value for MCC. And it's wonderful to hear that coming through. Annie, would you add anything to these last comments?
No, I mean, I can give some very specific examples of things that we wouldn't often think about, like when we're doing an agricultural training, you know, where is the location of that training and at what time of day does that happen? Because if it's far away, if it's somewhere, you know, that a woman might have to travel a distance to go, you know, she's got other things to do. It might not be the right time of day. So like our partner in DR Congo, the same one from the story that I shared, what they did to try to get around that is to bring the field worker, the extension workers to the women as they're working in their fields. So women don't have to take time out of their day to go to a different location and pay transport costs or sit in a room for an hour. They can just go about their work in the fields, planting their vegetables, weeding, and an agricultural worker will come and answer any questions that they have and provide some hands-on training. So that's a way that our partners have been working at trying to make it more accessible for women to participate fully and benefit fully from our programming.
I have some other, really practical questions here too. Um, how do women go about actually accessing services? We work with a particular partner in Beirut or a particular partner in San Pedro Sula. Um, what's the approach? How does someone actually become a beneficiary of some of the work that MCC is doing? Annie, do you want to start this time?
Sure, yeah. I mean, I work primarily with a lot of our emergency response programming, so that's kind of the lens that I see this through. But one of the things that MCC always works with our partners on doing in most locations is to work with a local community group. So forming a group that's made up of community members, of people who have been affected by the disaster, maybe people who are displaced people, and relying kind of on those community members, people who live in that location, live in the village, to help identify who is most vulnerable. You know, they see each other on a daily basis. They know the situations of their neighbors and of the people living in their communities. So we work with those local community groups. We try to make sure that there's 50% women, 50% men on that group. So there's people of different economic standing. Some people are business owners. Some people are displaced people. They have little resources, but together they help our partners make those decisions about who is the most vulnerable in that community. And then they go out and they reach out to them and ask them some questions to help try to identify them.
Very helpful. Lisette, access to programs?
Yes, absolutely. It's relying a lot on local expertise, and also many times the people, the partner organizations work with the communities in the same communities, making a list of who are we going to be working with, who needed the most. And something about the story in the Atitlan Lake, the partner invite the people that they has been working with, the participant of their project. But as the participants start coming, they start talking about other women in the community that were in greater need too. So, and even that expand the scope of the program. And in fact, this year, we're starting as April 1st, we're starting a new project in the community there in another location that through last year lockdown, the partners, those women start getting to know them, identify people who was in greater need than some of the participants. And what they're doing now, they are graduating some of the participants and reaching out to other people. So that happened because being in the communities and also having the trust of in being able to hear and see what's really happening in the community.
It's a really helpful illustration, Lisette, of how deeply committed we are to working through partners, that MCC is not sitting up here making choices about who beneficiaries are going to be. And then these inspiring stories of where people step aside and say, actually, somebody else needs this more than I do. Yeah, that's a very powerful story. I have a question from Facebook here about mental health and trauma. And, we all know that this is having, Lisette, you've been talking about the heaviness of people being locked in their, not physically locked in their homes for 10 days, but not able to leave until their number comes up, as you said. Are we involved in supporting mental health and responding to sort of those sides of COVID's impact on women and girls? Either of you?
Yes, I will say yes. In some ways, has been very formal, like developing a whole curriculums and carrying out that through either Zoom, WhatsApp, women's group at the churches, something like that. And for example, in the case of Honduras, we invite somebody, they came and spent 2 weeks doing just mental health, working with at least one community that was hit very, very hard with that, and in talking in providing those space for conversations about like what kind of the community that we have now, what we naming our losses, but also naming our strengths, what we still have. In that sense of community, for example, that was something that people, again, we lost things, but we still have a community of faith. We still have a community that care and help each other. So I think MCC has been more intentional about providing those space for people to reflect and name what they're facing really. And I think that is added value that we have.
Yeah, I definitely think, with all of the projects that I regularly see, we do a lot of food assistance and we do a lot of, water and sanitation work, but we also do a lot of peace building and trauma healing work in different locations as well. Whether that is, like Lisette said, more of a formal project, or whether it's just making sure that our partner staff are trauma informed, how they know what trauma means to people and how to talk with people in a way that makes them feel safe and makes them feel supported by our programming. So it varies on location, but it's such an important piece, that trauma piece, because if you don't address it, then how do people move forward? And you need to be able to help people through their mental health concerns, while they're going through these very challenging situations. I'm sure we can all kind of identify with that feeling of isolation and loneliness and stress that happens for all of us when we're in COVID, even if we're not in an active lockdown, but it's just not your normal life and it feels a bit off. So, and then just imagine having other things layered on top of that. Like Lisette said, hurricanes, or conflict, that's a lot of trauma that people are holding on to. So definitely, MCC is not perfect, but we're becoming more and more aware of how critical that trauma piece is, and making sure that we address that so that people are able to move on with their lives in a healthy way.
And I just want to add one example is through some of the conversations or sharing that happen. It is given a name, like you are acting normal under a very hard circumstances, just like naming, like you have headaches, you have pains, you have this, and people saying like, yes, I do have that, and I'm no, that's normal to have all those after this. So just normalizing how are you feeling is very powerful, because then women know that they are no extreme and they can voice that, this is something outside that is affecting me inside, and that is fine. And that is something that we are trying to open those space about, normalizing like you are deeply affected and honoring that.
Yeah, thank you for both of those pieces. I think it speaks to a growing well-roundedness, I hope, to MCC's work, the recognition of this. You used the expression, Annie, trauma informed. Earlier, Lisette, you had also said a little bit about how faith communities have much to bring here, and I think that's a really central part of MCC's work. Many of our partners are faith bodies. Some of them Anabaptist, others are not. but recognizing that in many, many communities, the faith community is core to how people understand themselves, how they have health together in community. And I think I'm really excited to hear how you described the way those parts play into our responses here to women and children. I think another way that we are well-rounded is that MCC has a strong advocacy voice in, well, in COVID now, but also in response to many other of the issues you've talked about. You talked about peace building earlier, Annie. Here in Canada, we have a lot of our advocacy out of the Ottawa office, and I've just been working with our staff there around vaccine justice. There is enormous vaccine inequity in the world, and we haven't talked much about that tonight, but I think all of us know that even as we in Canada and in other places that are represented on this call tonight might feel that the vaccine rollout isn't going the way we should, we know that compared to much of the world, there's just a gross inequity between those getting it quickly and those who might be 2 or 3 years away. So I think I want to just remind us all, our listeners as well, that as we are listening to partners to make choices about how we're going to respond with a humanitarian kit, we are also listening to partners as we do our advocacy work, including around vaccine justice. We are very close to the top of the hour here, and I am soon going to spend some seconds and minutes, maybe even saying some thank yous. I'm going to have one more question. It's a really practical one for you, Lisette, and it speaks to this layering of disasters. Someone's asking if, in addition to COVID, now with those 2 hurricanes last fall, are we going to see even more people leaving parts of Latin America because of not having options?
Absolutely. There have been 3 new caravans between December, January, and if I'm not wrong, it is 2 weeks ago, there was another one that left. And that's just like people doesn't have a choice. That's what they keep saying, that we lost, or I mean, people have already lost jobs because of COVID, but then you also lost your house and whatever things that you might have probably put a small business at your house, but then you lost that because the water, you have a storm on November 4th and another one that hit in November 16th, then everything wipe out. So how you survive, how you can continue really deciding to stay, plus violence, corruptions, and health system collapsing. It is very challenging.
And I know MCC makes choices about how to use our limited resources, but I'm glad to say that MCC also is very attentive to the issues of displaced people, people on the move, forcibly displaced, including by disasters like the hurricane. So there are many ways for those of you listening in tonight to stay engaged with MCC. Being part of our webinar tonight was certainly one of them, and so I want to start my expressions of gratitude to the listeners on Facebook and web and the Zoom channel. Thank you for taking part of your day and being present with us. Thank you to you, Annie, and to you, Lisette, for being personal, candid, honest, and for bringing your women's perspectives to this really important place where gender and the specific impacts from COVID are an important part of MCC's work. If you asked a question tonight and didn't get an answer, our apologies. We will try to respond to you in writing, and so you may still get an answer even if you didn't hear it on air tonight. And we want to keep presenting these kinds of opportunities. We know that we're in a different time and space than we've often been in pre-COVID, pre-pandemic. So there's podcasts, there are going to be more webinars, a new podcast that's out now on relief development and podcast. These are available wherever you listen to your podcasts. This month's looks at how COVID-19 is affecting asylum seekers at the American border. So playing back to the last question that Lisette answered. So we are very grateful for your joining us tonight. Grateful for the many other ways that you are part of these stories, really, that Lisette and Annie were sharing tonight. We invite you to stay engaged. Join us for the next webinar. Listen to a podcast. Continue to pray for our friends and partners around the world. Thank you for being with us. Bye for now.